For women of all ages, a healthy vaginal ecosystem plays an important role in their well-being. Disturbances can negatively affect their quality of life. Vaginal infections dramatically disturb the healthy vaginal ecosystem. There are 4 main infections: bacterial vaginosis, vulvovaginal candidosis, trichomoniasis, and a group of still poorly described aerobic and mixed infections. The most common disorder is bacterial vaginosis. In bacterial vaginosis, the healthy lactobacilli-dominated vaginal flora is replaced by anaerobic and facultative anaerobic bacteria, such as Gardnerella vaginalis and Atopobium vaginae. Typical symptoms include homogeneous grayish-white discharge, as well as an unpleasant fishy odor. During clinical diagnostics, the pH may be elevated above 4.5, and a typical microscopic finding is the so-called clue cell phenomenon. No redness or other signs of inflammation are observed. The bacterial vaginosis is often associated with negative pregnancy outcomes, like miscarriage, as well as a possible increase in the risk of acquisition of sexually transmitted infections. Treating a vaginal infection usually starts with antimicrobial therapy. There are various antimicrobial treatment options. The use of a broad-spectrum anti-infective like dequalinium chloride seems to be one of the best options because many vaginal infections involve various pathogens. Fluomycin vaginal tablets contain 10 mg dequalinium chloride. As this quaternary ammonium compound is active against all relevant vaginal pathogens, fluomycin has a broad-spectrum antimicrobial activity. The primary mode of action of fluomycin is the absorption on the cell membrane, and thus disturbance of the cell permeability, leading to the destruction of the pathogen. The secondary mode of action is the denaturation of proteins and precipitation of nucleic acids, which leads to the deactivation of the pathogen's enzymes. Deprived of these vital functions, the pathogen cannot survive. Besides the most relevant pathogen in vaginosis, Gardnerella vaginalis, the newly described pathogen Atopobium vaginae plays an important role in the pathogenesis of bacterial vaginosis. It is considered to be responsible for bacterial vaginosis-related complications during pregnancy and disease recurrence. Notably, most clinical isolates of Atopobium vaginae are commonly resistant to metronidazole treatment. Recent scientific results suggest that Atopobium vaginae, along with Gardnerella vaginalis, plays an important role in the newly described virulence mechanism of biofilm formation. Commonly used antibiotics, such as metronidazole, are usually not able to fully penetrate this biofilm structure, leaving a residue of pathogens after treatment. Fluomycin has been demonstrated to penetrate the bacterial biofilm, destroying the biofilm matrix and attacking the pathogens within. This effective eradication of pathogens could minimize possible disease recurrences. The broad-spectrum activity of fluomycin is an effective option for women of all ages as an empiric therapy for different vaginal infections in daily clinical practice. In clinical studies, fluomycin has been demonstrated to show comparable efficacy to current gold standard treatments. Another important advantage of fluomycin is that it can be used during all phases of pregnancy, including the first trimester because of its primary local effect and negligible systemic absorption. Additionally, due to the multiple modes of action, resistance of various vaginal pathogens is unlikely and has not been reported. Dequalinium chloride is a broad-spectrum anti-infective for the treatment of vaginal infections with good tolerability and a high level of safety, even in pregnancy.